Yes. Which can be scary. And I'm kind of reading through a
Yeah.
series of questions that are all around, um, what are the downsides of getting this germline or genetic testing done? And, could it in fact impact my insurance? Can it impact my eligibility to participate in clinical trials? Would it just cause for, a sister or a child of a survivor? Could it just cause anxiety that's not necessary? So maybe you could just, I know that's a lot in one, but talk about,
Yeah.
you know,
Yeah. So first of all, again, we're talking about not the most common scenario, right? So it's much more likely that you'll have germline testing and it'll be negative. So again, it's not the most common scenario. I know whenever we have the discussion, it sounds like, this is going to happen to everyone that has breast cancer. It's just not the case. Most of the time, um, a significant mutation is not found. That's number one. I think in terms of anxiety, every cancer discussion I think is fraught with anxiety. Nobody wants to even say the word cancer. People don't like to talk to me once they find out I'm an oncologist, right? And so that no, I'm serious. But there is a big fear in general around cancer, right? And that's why I do have such respect for what cancer patients and survivors go through because like everyone's afraid of this, right? And so I is there anxiety? Yeah, but I think there's anxiety as soon as you hear you get diagnosed, I think. And so I don't know that that's any different. What I do like to say to people is, I mean, you have a chance to help and empower the people in your family if you do find something. Having a discussion with younger people, really in terms of earlier screening, um, and when they should start, and if they have a mutation that portends that they have a higher chance of getting cancer, that they will either catch it early or even be able to take preventative measures to prevent it altogether. I think that is such a powerful thing to be able to give to the family. But I think it is also very personal. I guess everyone has to kind of think about um, those that risk of anxiety versus the benefits. The other thing is that families don't like to talk about cancer. Again, I'm an oncologist. There are people in my family that have cancer, and I still can't get the details sometimes because there is such a fear around sharing this.
mhm.
And I just think we have to start having these conversations in our families. It's so vitally important. We're also seeing cancer demographics, younger people getting diagnosed with cancer. Almost every year there's another study, younger and younger people. And so I think anything we can do to help that is important. I don't know if I answered the question. I think I got on my soapbox. I'm gonna get off it.
I think you did. I think you did. And I love the soapbox speech because I couldn't agree more. Before I was diagnosed with cancer myself, if a cancer commercial came on the radio or the television, I could not turn it off fast enough. It was just like I did not. So I completely relate to that. But obviously, having gone through it and now doing this as my line of work, the more conversations that I have and the more I'm able to educate myself, it has helped with my anxiety and kind of given me more hope and purpose in the
Yeah,
diagnosis. So I would just
I think
encourage
that's really beautiful.
others. And the one part that we didn't touch on was about it maybe impacting your eligibility for clinical trials. And as
Oh,
someone,
yes. Mhm.
I've been involved in two early stage clinical trials now, and I mean, please weigh in. But at least for myself, they will turn you inside out with all the testing. So if there's something they want to know and you haven't yet had that testing, you'll likely have to do it as part of the eligibility criteria getting
Mhm.
onboarded. So I wouldn't not do it because you're afraid it'll impact your future.
Yeah, no. And the other thing is there are clinical trials for people who have these mutations now. You
Exactly.
know, like I alluded to the fact that there are some treatments which are for patients that have germline BRCA mutations now. And that was only because of clinical trials for those patients. So, you know, I think clinical trials, you actually might be helping because you will find yourself eligible for more things probably. If we do find if there is a